Hi and welcome to the Homeopathy Health Show. I'm Atiq Ahmed Bhatti, a fourth generation homeopath with over 25 years of professional experience and practice in this field of healing. The Homeopathy Health Show is the online voice of homeopathy around the world, promoting and raising awareness of this truly unique system of healing, which is suitable for all ages, young and old. Every week I invite guests from the world of homeopathy to come and share their experiences, their work, offer insights, and essentially talk all things homeopathy. Why not visit www.liketreatslike.co.uk and click on the radio and podcast button to listen to the latest episodes. So let's begin today's show here on UK Health Radio, the world's #1 talk health radio. Hi, welcome to another episode of the Homeopathy Health Show here on the UK Health Radio Network. I do hope you're in good health and that you're keeping well. Now, my guest on today's episode of the show is Fusun Minkari, who is a graduate of the IACH, the International Academy of Classical Homeopathy, which is based in Alonissos in Greece, and as you very well know, was founded and is currently headed by Professor George Vithoulkas. Now, Fusun is a graduate of the IACH e-learning program and has spent a good amount of time with the good professor, Professor George Vithoulkas. She is also an IACH diploma holder. Fusun, thank you so very much for coming on the Homeopathy Health Show, all the way from Turkey, if I'm not mistaken.
Yes, thank you, Atiq. It's very nice to meet you also. I am based in Turkey, yes, in Bodrum. And I am graduated from IACH. And after being graduated, I have been appointed to be the coordinator of the IACH in the UK.
You know, I went to Turkey when we was talking, when we
That's
first
good.
made contact, and I went to Istanbul. I love it. I love the culture and I love the ease. It's very busy, I have to say, right? But it's so relaxing. I tell you what we used to do with the family every evening. We were there for about 10 evenings, right? So 10 days. Every evening in the place we were staying outside, there was like a city center. So we'd come down from the hotel room and we would, actually, it was an Airbnb. I'm mistaken. We're not a hotel room. So we would come down as a family and we would just sit on the steps of one of the restaurants and just watch people going by. And there was buskers going, people singing songs, and we could hear the call to prayer from the mosques because there were many, many mosques there. There are many, many mosques there. And it was such a nice time. It really was. But so yeah, I've never been to Bodrum, but I'm quite sure it's just as beautiful as Istanbul.
Yeah, I'm happy that you liked Istanbul. It's a magical town with a lot of history behind, centuries, and so many civilizations live together there, and you can track them everywhere, in every corner in Istanbul. You can track the old civilization. Bodrum is the same. Many centuries with civilization, just because of the weather, which is always wonderful, really.
One of the most historical things for me in Istanbul was going to see, it may sound odd to some of the listeners, but visiting the graves, of some personages, that were very holy. And, we spent a good amount of time doing that, in one of the evenings. And we found a very beautiful, a loving gentleman who spent his whole evening taking us around, and that was really nice because I love history. I mean, who doesn't, right? And it was really nice to be able to see and witness that history, times gone by, and yeah. Anyhow, fond
That's
memories.
good. The food also is so big. The Turkish cuisine is really colorful and tasty.
It
Yes,
is.
yes.
I think I overdid it with the shawarmas, though.
Hmm.
So,
That's great.
Fusen, you've studied, of course, with Professor Vithoulkas, but what's your journey been in homeopathy?
Yeah, like every mother, I think, who doesn't want to give medication drugs to their children, I started at home with my children, and I was thinking that homeopathy was just for the ear aches and the sore throats and flus like that for a long time, really. And then I realized that homeopathy is a real big science, and it's a huge world of understanding humanity. And this is true, Professor George Vithoulkas, that I realized that really, because when Professor talks about homeopathy, it's not only homeopathy, it's all the science of humanity. I mean, really, what is health, what is disease, why do we get sick, and everything. And yeah, I would love to talk about Professor George Vithoulkas, how he started and how he established IACH and how the courses are run in there and how the students get so wide vision of homeopathy and on the health of the organism of the human being and health and the disease.
Yes, so let's go with that, because I know that
Okay.
Professor Vithoulkas is, of course, known around the world, in
Yes.
especially within the field or under the umbrella of homeopathy, classical homeopathy. And in fact, I've had a few guests on the Homeopathy Health Show who have studied at the International Academy with Professor Vithoulkas. So do share how this academy started and your encounters with Professor Vithoulkas, because it would be very nice to relay some stories, perhaps, or incidents, just so we get an idea of the professor himself.
Oh yeah, there are so many stories to tell because in within the lectures when he's giving explanation teaching he's always enriching this with stories that you can never forget about the theories about the remedies. He gives such examples from the life real life that you will never forget. Oh yeah, Professor George Vithoulkas met homeopathy when he was working in South Africa because he's a civil engineer actually, and he was there for work. But by chance, he discovered in the bookstore the Materia Medica of Burike. When he started to read it, he just read it like in one breath, and he was fascinated with the homeopathic philosophy. And then he decided to go further. He learned, he studied the homeopathy in South Africa, and he went to India to learn the practice of homeopathy in 1963. Because in India, we know that this is the country with the largest number of homeopaths and so many colleges of homeopathy, like 200 in India. And he chose to be there for the practice, to learn the practice of homeopathy. And then Vithoulkas came home in Athens in 1967, and he was decided to introduce homeopathy in his country. Immediately in 1970, he established the Center of Homeopathic Medicine in Athens. And he gathered 30 medical doctors and he taught these medical doctors homeopathy, the philosophy, the practice, how to take cases, all the remedies, and how to prescribe. So they started to work together, so like hundred thousands of patients visited this center, and it was known all around the world. And Vithoulkas was invited everywhere in the world to talk about homeopathy and about his experiences, his observations. And he didn't stop only by practicing homeopathy in his center, but started to write books. In 1978, The Science of Homeopathy. This book is translated in 37 languages as per today.
Hmm.
In next year, 1979, Definition of Health, the book was written. 1985, New Model for Health and Disease. And 1990, he started his own Materia Medica Viva, supported by his confirmed observations. Because because he had so many patients to observe, and he has such a great vision for observation, the humanity, the human organism. So he took notes about the organism which reacts different in the disease, in the healthy state, and after remedies. He took that notes, and then he realized that there's something which is going together with the level of health of the persons. So his successful practice was noticed by the global homeopathy community. So he traveled around the globe, invited to homeopathy congresses, universities, where he presented live cases in front of the audiences. This is also very special for Professor Vithoulkas. He takes the cases that he never saw before in the audience, in front of the audience, and together. Sometimes he asks questions to the audience. Would you have a question? What do you think?
Yeah, I was just going to say that that's such a wonderful way of teaching anyway, because we all know whatever the subject, it doesn't have to be homeopathy, of course, but just generally, when it's interactive, that's
Yes.
actually where the skill is. That's where you learn more because you have an opportunity to ask questions. And when something is taught in an interactive way, the chances of remembering are far, far greater than when you're just listening, because interaction keeps you awake as well. It's a psychological way of teaching as well, isn't it? Because you stay awake because you may be asked, or you can have some input. So yeah, it's a wonderful, wonderful way of teaching.
Yeah, and it doesn't stop only, for example, giving the first prescription, but he also records the follow-ups. What happened to the patient and why this happened. He always analyzes the case with the classroom, because we have a virtual classroom in the recorded lectures in the e-learning program. And these lectures were taken when the IACH was established first in alonissos. So for many years, it was in alonissos. The study was taken only on the island. And then in 2010, the e-learning program was launched online. All these lectures that was pre-recorded in the lectures in alonissos now are on the e-learning program. So always, our teacher is always Professor Vithoulkas. And what is very interesting also, the classroom at this moment in alonissos, the classroom was full of expert homeopaths. So the students are already very qualified, expert homeopath, practicing homeopath. So what happens in this classroom? There are questions. When we are watching a student now, we are in a virtual classroom where our classmates are practicing homeopath. So the questions which are coming from them for a remedy, their experiences or a life case are so much expanding the subject, the lecture. It's very, very useful. So this is also an advantage for the e-learning program lectures, where the student can ask and expand, and it helps understanding better with the examples that they are giving, and Professor Vithoulkas explaining. Sometimes they have questions, why did it happen? And then professor can explain very, very clearly why did it happen.
Do you have any examples?
Oh, yeah. For example, for remedies, a lecture for Staphysagria, let's say. He starts giving the keynotes, essences of Staphysagria, but because this is a sensitive remedy, he cannot stop himself to talk about all the other sensitive remedies, comparing, differentiating with examples. And we have, for example, in the e-learning program, papers differentiating egotism, for example. It is so important because for Professor Vithoulkas, the egotism, the selfishness is a basis for a disease. And he explained why. Because egotism is connected with conscience. And conscience is something inside that is controlling ourselves. We are always in control of our conscience. And our conscience should always decide the right thing, the good thing. And what is happening to this conscience or egotism that it cannot decide the good or the right thing. So what is the pathology which is coming with the egotism which is disturbed? And all the remedies that they have this egotism in their materia medica, but there are always differences. For example, the egotism forum is something else. Egotism of Lagopodium is something else. He says it's superficial, it's just show off. Or egotism of Medurinum or Barita Carbonga. They are all different kinds of feelings. And he explains everything on egotism. So it's not only remedies from A to Z, but he always put everything together for us.
Wonderful. A very comprehensive way as well, isn't it, of teaching?
Yes, yes, very much, yes. So when he saw that he was very successful with the practice of homeopathy in this homeopathic center in Athens, he decided to teach homeopathy. And in 1995, he decided to establish an educative institution, which is International Academy of Classical Homeopathy, which is established in Alonissos, Greece, the island where he chose to live. And there he started his courses for homeopathic education. This homeopathic education is only classical homeopathy, based only on Hahnemann and Kant's teachings only. So when we learn the classical homeopathy in a so correct way, we shouldn't make mistakes. We shouldn't make mistakes because really it is explained so beautifully. And apart this, because of this multitude of patients that he could observe the similarities of the organism, he could write this theory, the levels of health. He noticed that some people with the complaints, really severe complaints, but the remedy is so clear. But with another patient which comes with severe complaints, but the remedy is never clear. Why it's not clear? Because there are many layers, many diseases accumulated on top of each other, and the symptoms are confused. You cannot differentiate the first remedy, for example, so clearly than the other patient, which was very, very clear. So he said, why is this? Why? And why this happens? And then he realized that this is about the predisposition that we are born with. And the 12 levels of health, the theory of levels of health, says that people are born in approximately 12 levels of health. It's indicative, of course, it's observations. And these levels are separated by depending on the number of predisposition that people have. Because the question starts from why do we get sick? We get sick if we have a predisposition. If we don't have this predisposition, we don't get sick. So depending on the number of the predisposition, what comes out, the remedy is clear. Remedy works very well. when remedy is clear, you can go in the potency very high. So it works very quickly. And so these are now for the students of the e-learning program of IACH, these levels of health is a tool to understand the patient at the first consultation. On which level of health is the patient? How should be the approach? How can I clarify the first layer's symptoms? How can I differentiate the first remedy? And then again, for potencies, prescription. Okay, now I found out the remedy. Now it's about the prescription. How high can I go? It is a weak organism. Can I go high? No. This is also prescription also, and the regimen of the prescription is also very well measured. I can say really measured by the theory of levels of health. And then comes follow-ups, because we give a remedy, and what happens then to the patient? We need follow-ups to see what happened. For the follow-ups, of course, Dr. Kant also has 12 second prescription observations. Professor Vithoulkas modified these 12 observations to 22. And he didn't leave just a single possibility away. When the patient comes back on the follow-up, what could happen? So these are all in graphics, and you can see, you can judge by the consultation of the follow-ups, where is the patient, on which graphic, on which observation is my patient after the first remedy, because after the first remedy, now is the situation, and on these graphics, you can see what to do. It is also a big tool for the students of e-learning program for the follow-ups to understand the patient and follow the treatment according to the situation of the state of the patient at the follow-up. These are great tools and great advantages of the e-learning program. The other thing is clinical practice. Clinical practice is given as lecture in the e-learning program. We watch like 100 live cases with follow-ups taken by Professor Vithoulkas himself, a legendary homeopath. He takes the first consultation. He comes to the classroom, discuss the case, analyze the case, differentiate the remedies, and prescribe. And then we continue with the follow-ups until the patient is completely healed. So this is given as a lecture. So after we finish the e-learning program, we know how to take a case, because when Professor Vithoulkas is taking at the first consultation, maybe in 10 minutes, he recognized the remedy, but he doesn't stop there. He gives always 1 hour of consultation to us, to the students, the methodology of how to take a case. He never leaves in the middle of the consultation, from the beginning to the end, questions that should be asked and points that should be go a little deeper. When he gets, for example, a keynote, we have to confirm. So the methodology of case taking is given in lectures by Professor George Vithoulkas with the examples, the real live case examples, discussed remedy differentiation and prescription in the classroom. This is a great, great learning.
It is indeed. It does. You know, what's quite interesting here is the fact that it is a large majority of it is not only interactive, but also the fact that things are broken down into very minute details, it seems. so that the student can really get to grips. And there's no, I suppose you could say there's no questions left unanswered as such. So it's quite methodical, isn't it? And quite, you know, thought out as far as the depth and the content. And also, you know, you mentioned the 12 levels of health, 12 levels of health rather. And you also mentioned the fact that, um, you know, there's nothing that the professor left out as such. So all questions are answered, and that's good. I mean, I think that's again we
Yeah.
go back to that same point. It's a very comprehensive way of learning.
Yes. Yes. And we have webinars. IACH also is a community. It's like a family. We are always connected together. We work together. And IACH is operating in 97 countries in the world. And all the countries have their own coordinators, diploma holders from IACH. And we always get together for meetings, talking together, supporting each other. And also for the students, we have regular webinars. In these webinars, there's always a topic, and our senior students, or Professor Vithoulkas, Dr. Atujagi, Dr. Sema Mahesh, Mahesh Malappa, and Christina Horvat, Latika Jagi, are giving examples of live cases that they have taken with the levels of health approach and remedy reactions for the follow-ups. And at the end of the presentations, we discuss again for this particular case, what was the levels of health? Why did we prescribe like this? And what happened at the follow-up? So I remember one case, which is in the remedy reactions of Professor Vithoulkas, and the doctor who presented the case said, nowhere else you can find this. This was about like that. So the remedy was very clear for the patient. The doctor prescribed, but when the patient came back for the follow-up, patient says nothing happens, no effect. But the doctor was so sure that the remedy was so clear and it should have an effect. So we go to the observation where the patient says no changes. There's 22 graphics. We have one which everything stays on the same line. Nothing changed, no change. So when you go there, you will find different conditions. It may be this, it may be that. But there's one thing that Professor Dr. Atildjagi said, only professor put this notice, maybe the remedy is spoiled. Maybe the pharmacy, when they took the pharmacy from the pharmacy, maybe the remedy was spoiled. Maybe the remedy was not very well potentized. Change the pharmacy and try the same remedy from another pharmacy. And it worked. So this is a very, very important observation.
I was going to ask you about the setup in Alonissos as well. So there is a fully functional clinic? Is it
the academy is there, and it's not a clinic, but it is a teaching institution. So there's the big classroom, and there's the office of the professor, where he will take cases. These appointments are made from the students of the professor who are participating to the webinars there, for example, and they bring their cases where they couldn't reach the right remedy or they couldn't reach the right treatment. So they come to ask to their teacher, what can we do for my patient? So these kinds of appointments, the patient comes, we don't see them. They are in another room in the office of the professor. We only see the video. We can hear the talking, we can hear the case taking. And then when the first consultation is finished, professor comes to the classroom and discuss the case with us, with the questions. And of course, one of the most important questions is, which homeopathic remedies did you use before? And which one helped? So this is a crucial also question for professor, because all the cases that comes to alonissos to see him is like that. They maybe tried like 20, 25 remedies that didn't work. So it is a vision, a methodology that the professor find another remedy which was not thought before that.
I was going to ask you also with regards to the academy itself. Is it how long is the course, the initial diploma? Is that over a year, 3 years, 4 years?
We have 2 years. We have the recorded lectures. So it can be taken individually or in a group courses. Group courses mean we meet in a classroom, in a virtual classroom on Zoom, and we watch the videos together, and the coordinator of the program for the UK, it's me, we discuss the lectures. We can take the questions from the students and answer them face to face. So we are together in a virtual classroom. Or it may be taken individually, and students can watch the videos anytime they like in their most preferred time. And there in the individual program, they can ask their questions in the forum platform, where they can see the questions of other students and the answers that were given by the coordinator of the individual program to their question also. So these are for the individual program. The program is active for 2 years. That's why it is called 2 years. The group course, the virtual classroom, also is scheduled on a fixed schedule for 2 years. But within these 2 years, there are modules, 150 remedies, theory, the questions and answers, topics, research methodology, and the cases, of course, 150 hours of live case taking in lectures. Within these 2 years, we have progress tests that students have to pass for each module, for materia medica A, B, and C, and theory, repertorization, and organon. When it is completed, the whole courses, whole lecture are completed, and the progress test passed, then starts the 3rd year, where the students should take a final exam, where the exams that they have taken, the progress test, will be all together in one exam, or similar exam. And when they pass the final exam, they will have 1 year to submit on our platform again, 10 cases that they will take. So here also, the submission is very clear. For example, the level of health of the patient is asked, and the follow-ups, all the cases that, the 10 cases that they will submit should have also 2 follow-ups within at least 6 months. And these submissions of cases are supervised by the coordinator, asking questions: why did this happen? What did you think? And how was it? How did that? Questions like that. And after that, when the 10 cases, one after each other, approved, the diploma is very near. One other thing is that the anatomy, physiology, and pathology course, that students who doesn't have a medical background should have taken a certificate from an online course that we also recommend, anatomy, physiology, and pathology courses the final exam passed, the 10 cases submitted, anatomy and physiology certificate together, then this is the achievement of the IACH diploma.
And how busy are you though with the students?
Yes, my group now, we are finishing at the end of the year. We are three. I have three students and they are doing very well. They have passed the progress test and we are in 6 months we will finish the course and then they will take the final exam and then submit their 10 cases.
And for those interested to find out more, they can, of course, visit the website, which will have all the
Yes.
information. Yes. I was going to ask you, with the work that's going on, I know many homeopaths have also been mentioning that the professor, because of his ripe age at the moment, he's slowing down perhaps. So what's the how will that work as far as transition, or is he still very much fully involved?
Fully involved, working so hard, and he just published a paper, a research paper, because he is so much decided and eager to let the world understand this homeopathy in full words, really. But the researches, which are the controlled trial, random, this kind of scientific researches, cannot be done in homeopathy. Homeopathy is individualized. We cannot go in trials with placebo effects and everything. Impossible, because everyone is individual by his levels of health, by everything, by environment, causes of diseases, everything. We cannot go into researches. So what Professor thought about, he said now that quantum physics, he's fond of quantum physics. He always reads and follows the quantum physics, and he explained it very in simple words. And let us, he says, let go further and research yourself. And he's informing us, for example, in neutrinos, the massless particles which are carrying information. There's always science with Vithoulkas. And the last paper he published, it was about a research that he started 5 years ago. And now that the physics laboratories have very sophisticated microscopes and deep learning softwares, Raman streptoscopes. So he asked two different laboratories to find what is in the aurum remedy and in high dilutions.
Hmm.
So this paper is now published, finding first how our remedies are prepared. First dilution, yeah? When they are diluted, they could find nanoparticles in aurum 200. They could find, because they are very sophisticated stethoscope, yeah. Plus the energy field that that we are creating with the succussion. This is also measured. So professor is very happy to finish this research in two different laboratories that they will confirm each other. And this is not all. He's continuing on writing his Materia Medica Viva on volume 14 and continues of writing articles on many ideas that he's thinking on and doing the researches and publishing all the time papers. We meet him every week within academic meetings, and he's always making us think further, think further, think further. Every time we are together, we have a big question in mind to go further with that. It is so amazing, so amazing. Yes, his vision and thinking, and ideas, and it is so clear, really. He gives us a so clear example that you can understand, oh my God, how could I, for example, neutrinos carry information. And we think, okay, what are these neutrinos? How information? And suddenly, in a minute, he gives an example. He says, a boy and a young girl, they are sitting together and they love each other and they are not talking. How do they know that they love each other? That's it. Here's the answer. Don't we know? Yes. Didn't we experience that? Yes. We know sometimes without talking. And how does it happen? This is the energy fields. And now the quantum physics, he also explains that he's also writing on quantum physics that the energy, we are, the building blocks of the human being are the energy fields. So energy fields are always interacting with each other. So changing information. It doesn't matter. We don't see the energy. It doesn't mean that they don't exist. They are everywhere. And he's always giving a concrete, really real example that we say, oh my God, yes, of course, always like that.
Wonderful, wonderful examples. I must ask you, for the purpose of the listeners, where can we find that paper, the research paper that the
Highly
professor has?
diluted. Yes. Yeah. It is on our website, vithoulkas.com. And the website, vithoulkas.com, and the e-learning program are connected. You can switch on both. And you can find there, it's a huge information portal, huge. And there are all the research papers that the Academy is publishing, because the Academy is also very special as a homeopathic institution to have a research department. The head of the department is Dr. Sema Mahesh, and professor is always encouraging all the students to take proper notes of their cases to be able to present them on a scientific article format. So we need some real information, good information, with numbers sometimes, with for example, blood examinations or x-rays, anything like this. He says, please collect them properly, write your notes properly, then we can publish. And this is our only way to show the effectiveness of homeopathy. We cannot go into scientific trials, but we can show one by one how homeopathy is successful, where sometimes the modern medicine cannot help. So the research department is always publishing case reports individually, the cases. There are a lot of them in our portal, and also the papers of Professor Vithoulkas, and also there are videos, examples of our lectures that you can watch freely. They are also very enjoyable and very much learning.
Wonderful. That's Fusun Minkari. It's been an absolute pleasure to have you on the Homeopathy Health Show, and just to share about the work of Professor Vithoulkas and the style and what's involved. I think it's been an eye-opener for so many. It will certainly become one. And thank you. I'm very grateful to you for coming on and sharing this information.
Thank you. Thank you very much, Atik. Thank you. It was wonderful to be with you. Thank you.
Thank you. And no doubt we will talk very, very soon indeed.
Okay. Yeah, of course. Thank you.
I do hope you've enjoyed this week's episode of the Homeopathy Health Show. Please do support the show by clicking follow on my socials. Remember, the more exposure the podcast receives, the better for homeopathy around the world. You can find me on Instagram by searching for @like_treatslike, and on both Facebook and TikTok by searching for @like_treatslike. So let's promote the voice of homeopathy on radio and podcast around the world together. Don't forget to visit me online at www.liketreatslike.co.uk and click on the radio and podcast tab. Here you'll be able to see all the guests that have joined me on the show so far. And of course, you can stream on demand the latest episode to your mobile, tablet or PC. Until next time, stay safe and take care.